Okay. So this is a full body 60-minute session with a hot pack and a focus on the upper back and neck. I've already placed the hot pack because I don't tend to consider that as part of the massage. I consider that as the same as starting like placing the bolster and getting everything all settled. So the time is now 11:48. I'm going to start my massage with my 2 good breaths because I like to establish some stillness. I'm going to start my comfort stroke on the scalp today, and then I'll jump over to the hot pack. And then I'm going to come down. I'm starting this massage on the legs. I'm planning on doing maybe 4 to 5 minute legs, including transitions, so that the heat can soak in while I do that. Lifting the leg out to the side. Sorry, my hands are so cold. And I'm just going to give a quick tuck at the inner thigh and leave the rest of the hip covered for now. Start with a good oiling stroke. Oiling strokes can be unstructured, but they don't need to be firm, but they should still feel presence. And then once I've got the lotion all spread around, that's when I start on the foot. If I started on the foot with all the lotion on my hands, the foot would be super gooey. Don't need that much lotion on the foot. And again, this is not following any particular routine. I'm going to be keeping in mind that I want my massage to be symmetrical-ish between right and left. But I'm not following any particular routine on the body because this is something that I am tailoring to the client's request of that neck and upper back focus. Normally for customer service, I do want to start with some amount of attention on the focus area. In this case, a hot pack, so that client feels heard. And just in case that focus area ends up taking up more time than I expect it to. It doesn't have to be the very first thing, but I try to get to it sooner rather than later. Obviously, there's always going to be exceptions, but that is the general guideline that I put out there for myself. Now, right now, I am not in the focus area, but it's still a full body massage. So I want to try to make sure each little zone gets 2 or 3 different types of technique. So for example, here I did some firmish effleurage ironing, and I did a couple of different types of petrissage. That variety helps the area feel like it's been thoroughly addressed and not just skipped over. I have had massages in the past where they just did some, 3 to 5 long strokes on the legs, and it was supposed to be a full body massage, and that did not feel very thorough to me. I'm seeing that I started this massage hands-on at about 11:49. It's now 11:52. So I know I've been going for about 3 minutes. So I'm going to move up to the hip, folding this back like the wing of a paper airplane. and grabbing just a little bit more lotion to work on the back of the hip. This is not a focus area, but it is a complex area of the body. So it's not a focus for this session, but the client did not indicate in our intake that he wanted any skips. And so making sure I at least do say hello and use a couple of different types of techniques up around the hip will be good. Also, anytime that you've got somebody who's got involvement of the spine, neck, upper back, we do want to make sure that we, if we can, try to say hello to the whole system of the spine, which the system of the spine goes all the way from your head, down your neck and back, through your sacrum and the pelvic girdle. I mean, your whole body is connected to everything, but I don't want to skip saying hello to the hip unless the client has specifically requested it. All right, it's now 11:54, so it's been about 5 minutes on this limb, and I know that if I'm gonna keep my good time management, that it's time to move to the other leg. Could I have spent more time on that hip and leg? Of course, but it's not the focus area for this session. So I need to use my brain to prioritize the time so that everything gets addressed. And again, we're just going to scooch and quick tuck, leaving the hip covered for now so it doesn't get cold. And now I've got my 4 or 5 minutes off for this limb, and the goal is to be symmetrical. So I'm going to start with my good oiling effleurage. I'm going to keep in mind the types of things I did on the first leg and try to make sure that I mirror them at least kinda. Clients might not necessarily notice if it's not like perfectly mirrored, but they notice if it's really different. And this whole time, I'm keeping an eye on my time. I've been talking to the camera, but in real life, after that first leg, I would have asked my client how the hot pack is doing. How's that hot pack? Is it getting too hot?
Perfect.
Okay. Just keeping track of time. I know that it's time to fold that sheet back like the wing of a paper airplane. I'm going to use the blanket to hold it in place. Grab a little bit more lotion. take a moment to circle the greater trochanter and spend a little bit of time on the back of his hip. My sheet falls down, I always just fix it right away because I never want to have my fingers go underneath the drape line and work on skin that's not exposed. That's a good way to feel invasive to the client. It's also a good way to have some potential oopsies. So we always want to only be exposing skin that is being massaged and is proper to do so, and we want to not ever put our hand underneath the drape line. So I see it's now 11:59, so that's about 10 minutes from when I started. You notice I keep my hands close to the body as I redrape the leg. We don't want to flap or floof, so the client doesn't feel that puff of air that makes them feel exposed. Goodbye, leg number 2. Hello, back. Moving. Oh, I meant to move the blanket separately from the sheet, but it's stuck together. That's okay. So now I'm ready to start massaging the back. I am done with this towel and will not use it again, so the ground is a perfectly acceptable surface. Alrighty. Now, in real life, you will notice that my client's upper back is not particularly red. That's because in real life, this hot pack, we came in over the break and the hot pack didn't have a chance to get hot. If it were particularly red, I might do a little bit more soothing and like assessing the texture and, you know, check up on, you know, if the client was getting overheated. In this case, I know the client isn't. So we are good. All right. So like I said, I want to address the whole system of the spine. So I am going to be doing long strokes up and down the whole length of the paraspinals, but it is a focus on the upper back and neck. So that's where I'm going to focus. My general plan for this session is to spend 5 minutes on the back of each leg, which I've done, and then have 20 minutes for the upper back, or for the back and shoulders, and the neck while he's face down. And I have some general ideas of how I'm going to do that, but I also want to be palpation-led in the focus area. I want to feel the texture of that tissue and see where that takes me while still keeping an eye on time. Okay. So, client.
Yes.
To me, you've got the levator coming up right here.
Mm-hmm.
Your left side on the levator feels a little bit denser than the right to me today.
Mm-hmm.
I know the right side has been more symptomatic for you in general. How does it feel from the inside?
It feels sore. I was at the gym yesterday.
Okay.
But the right side of my neck feels more stiff.
Right side of the neck feels more stiff. Okay. So I'm going to come around so I'm facing the client's neck, and I'm going to start to just soak into the neck itself versus down in the shoulder. And I'll address this neck again from a face-up position. I want to say hello, face down. Does it feel to you like there are more symptoms up by the skull, down by the shoulder, or somewhere in the middle?
Like right where your hands are,
Right
right
there.
there. Yeah.
Okay. So right now I'm on the various ropes of paraspinals that are coming up the back of the neck. Slightly on levator, but also kind of on splenius. Right now I'm doing hand on top of hand, hooking and pulling back with little circles as I pull back. Just feeling for the barrier of tension in the neck. And sometimes just pressing and holding and waiting for that to release. I got a little release there. How's it feel on your end?
It's getting there.
It's getting there. Good, good. You'll notice that especially while I'm in the focus area, I'm speaking to my client about their focus area versus the rest of the relaxation massage where I might not say anything if I wasn't speaking to the camera. Like I'd check in about pressure, but during a relaxation massage, you're not talking a lot. Even with a focus area, you might not be talking a lot, but some session focused communication is perfectly normal because you want to make sure that the session is effective and satisfying. So how's this amount of pressure on the focus area?
Good.
Good. So checking in about pressure, checking in, is it spot number 1 or spot number 2? All right. Okay. Now, in accordance with my kind of principles of massage, of always working from the general and then focusing in on the specific and then going back to the general, because this is a full body massage and not just a focus area, I am gonna start working, broadening where I'm working, taking in the whole neck and shoulder for a little bit here. We did get at least one release, which in a full body massage with a focus area is pretty good. I might focus in just a little bit more because I can feel some tension higher up. How's right in here treating you?
Good.
Do you want to focus on that or go back to lower down?
A little bit lower down.
A little bit lower down.
Yeah.
Okay. So we're going to use our time, see how I'm client-led and palpation-led. You may feel all kinds of things in their body, but that doesn't mean that every single thing that you're feeling in the order you felt it is the thing the client wants to work on. alternating with my good circulation. Now, anytime I'm working on the neck, I do want to try to be a little bit symmetrical. So before we move on, I am going to take a moment and also work on the left side of this neck, kind of in that same area I was just focusing on, just the other side. I'm going to start general with the whole neck and shoulder and then focus into that lower part of the base of the neck in the paraspinals. It's now 12:09, so in my head I'm thinking I still have a good 10 minutes in the back that I can devote to the focus area, but I also do need to get the rest of the back in there, including the low back and the rest of the paraspinals. This side is releasing a little faster. I'm doing that same hooked hand on top of hand and then pull back. Occasionally petrissaging with little circles. And then also still pressing hold. All right, and on the opposite side, how's right in here?
Still pretty stiff, but
Okay.
the weight there is a good spot.
Okay. Starting to let go more. How's that feel to you?
Pretty good.
All right, so now I'm gonna go back to the general area of this whole neck and shoulder. And I'm thinking to myself, okay, it's 12:12, so I have somewhere around 7 minutes to do the rest of the back, which is fine. This was the focus area, and I still have 7 minutes, and the trick is not that I go faster, it's just that I do each technique and in a really yummy way, but just fewer of them. So I'm gonna start, because I've just been at the upper back. I'm gonna start with some yummy little short effleurages. This might be called a shingle stroke. Short, straight, overlapping strokes. I'm gonna circle the scapula a few times. Client is being a little twitchy as I circle this particular scapula, so I'm just gonna give it a little tiny bit extra attention because I see that little twitch. My body might have been blocking it to the camera, I'm not sure, but if this had been a low back hip focus, one thing I sometimes do is turn the corner of the sheet so that I can get down into the glute and hip tissue from the back side as well as from the leg side. Not going to spend a ton of time doing that because that's not the focus of this session, but that's what I would do if it were. Each technique is still slow and yummy. In the interest of symmetry, I'll do that same thing again where I just fold back the sheet and do a very brief hello to the top of the glute and hip. Alright. Got just a couple of minutes left. And the back is nice and warmed up, so I'm going to use that time for some deep forearm ironing. Make sure my sleeve stays out of the way. The proportions are working out just fine on this client. On other clients, I might at that point have kidnapped that arm back up onto the table. I'll just show you, because then if the client were a little bit taller compared to me and I needed to step along, then I can do that without bumping into them. Because of course our massage tools should be the only thing pressing into the client. I've got my oil bottle nice and on the side, that doesn't press into the client. Any part of my body that's not part of the massage doesn't press into the client. I should be careful of my badge so that doesn't press into the client. How's this amount of pressure?
Good.
Good. See how that client, I don't know if you could tell this on the video, but as I came here, the client did a little stretch. Which could potentially mean my pressure was too much, or it might just be like, yeah, get in there. Glancing back at the clock, I see it's now 12:19. So that is the 30-minute mark for this session, right? Yeah. So we're gonna do a couple of goodbye back effleurages. Now I don't do this on every session. If I feel really oily, or if I know the client wants me to have cleaner hands for working on the face, I'll sometimes take the hot towel and get the excess oil off my client, which allows me to stealth get the excess oil off my hands, so that I've got cleaner hands and they're not all gooey and oily when I go to massage their face after they turn over. All right, I'm gonna do a little goodbye. I might just do heart and hara here, but because I'm about to grab the bolster, I'm gonna go all the way down to the feet. Grab that bolster out of your way. Give me one moment. Now, for the sake of the camera, I'm gonna come stand on this side so I can pin the sheet over here. And you go ahead and turn over and scoot down so your head is on the table and not the face piece. Want your arms up?
Yes.
Okay. Alrighty. And stir. How's that?
Perfect.
There we go. Okay. You know what? Same to you. Okay. And I'm now at the client's face, and now is where I can hit that neck again from a face-up position. But actually, while I have clean hands, before I put on more oil, I'm gonna do a little hello to the face. I always tilt my head to the side so I don't breathe right into their actual face. I do have some clients, even post-COVID, who prefer that I wear a mask through their session, partly because of health concerns, but also so that, you know, I don't accidentally breathe on them. Just gonna work my way down those chewing muscles, which if you think of, if you've ever seen somebody with a buzz cut chew and you can see it in their head above the ear, chewing muscles start up above the ear and the hairline, and they come all the way down the side of the face into the jaw. So we're not going to spend a ton of time on the face, but we do want to say hello because this is a full body. Okay. And now we're going to go back into the neck. Now it's already a little bit slippery from the lotion we were using on it before. I'm just gonna add like a jelly bean worth of cream. And I'm gonna check back in with my client. So before, the right side was feeling it more. Do you feel like you feel it in the back near the spine, or more like the side front?
Towards the spine.
Towards the spine. Okay. So client-led palpation-led, I ask where the client is feeling it, because I am not psychic. And then I go in. What I'm doing right now is I'm scooping underneath on either side of the spine, lifting the fingers up and pulling back. And I'm doing that very slowly to see if I can feel areas that are more dense or tense than the neighbors. Oh, I can't see my cup from here. Okay. Because I am, again, in the focus area. Then one thing that I'm doing also is I'm coming to the sides and squishing the paraspinals medially towards the spine. I'm kind of soaking into that same zone in the paraspinals towards the base of the neck. And there's a lot of texture in the fascia and also density in the muscle. Doing some general petrissage to get some good circulation and fluid exchange in there. I'm professionally making a lot of faces over here so as not to sneeze or anything on my client, which would be considered unsanitary. Crisis averted. So how's this spot feeling now?
Better than before, still a little stiff.
Okay, great. Now in a full body massage, better than before but still a little stiff might be as far as you get. That might be a point in real life where I would say, okay, well, we have, however much time left. We have a little over 20 minutes left in this session, and I would ask the client, do you want to continue working on this focus area for the rest of our time and see how far we can get? Or do you want to continue the full body? Now, I'm not going to give this client that choice today because this is also about time management in this video and we got to finish the full body. But in real life, that might be something I would do. It's okay to change the plan partway through if you have the client's agreement, right? It's their body. So You make the offer, would you like to stay here and focus on just this area, or would you like to move on and finish the full body? And they are the ones who get to decide what happens with their body. I am out of consideration for time now working a little more symmetrically. I was bracing the left and working on the right for a little bit, and now I'm working both sides at the same time, so we get a little bit of that balancing out symmetrical action. While not leaving the right side completely. Now the root of the neck goes down past the collarbone into the upper pec. And this is also a full body. So I'm just going to take a little bit more lotion and say hello to that upper pec just inferior to the collarbone. Oh no, I think to myself, it's now 12:31. I've gone 2 minutes over the time that I wanted, and so that means I have got only 18 minutes left to do all 4 limbs and the abdomen. But whenever I am short on time, I don't go faster or panic, I just do fewer things. And I will say at this point, if I have a third massage, or if I like to use 1 towel for each foot, so I've got 2 in there for that. I would sometimes use, instead of the back of the back for a hot towel, I would sometimes at this point grab that 3rd towel rolled up and put it underneath the client's neck, which actually I can do. Do you want a hot towel for under your neck?
Sure.
Unless you don't want it. So
No,
it's your
that's
neck.
okay.
Yep.
Yeah.
All right. So then I'll just have 1 hot towel for the feet, but that is okay. So I'm always going to check my temperature. This hot towel is not the temperature of the sun. So we're just going to slip that in there. In this client's case, it's a little lower towards the shoulder instead of up by the skull, because that is where we found the action. Is this the hand with the, no, it's the other one. We're skipping a finger on one of the hands. okay for your shoulder?
Mhm.
Okay. I'm gonna put your arm underneath the blanket just for draping in a second.
Sure.
You can bring it back out. How's the heat on the towel? Is it too cold yet? Or?
No, we're good.
Hot towels do cool off faster than hot packs. This finger, other finger. Did you want your chest covered when we do the abdomen, or do you?
No, that's okay.
Okay. Obviously, if this were someone of a female persuasion, I would drape the bust with the pillowcase. Which maybe I should have demonstrated anyway, just for the form's sake, but whatever. We're already moving on. So looking at my clock, I have just over 10 minutes. And I know I want to make sure this tummy massage feels nice and yummy. When I have a client who wants to include abdominal massage, it's usually because they think it is so yummy and relaxing. It is part of the massage, so we don't want to just skimp on it. But we do have to be mindful of time. from the blanket at this point?
Yes.
Okay. So we're gonna re-drape our client, do a little bit of heart and hara. We can do some pulsing on the sternum if that's appropriate for that client. And on to leg number 1. Picking up the whole leg and not dragging it in case the client has knee issues. Bringing the leg out to the side so there's room for us to do a quick tuck at the inner thigh. If I wanted to do a full tuck, where there's a little handle of sheet sticking out underneath the leg that the client could hold on to and like be fully wrapped, I could certainly do that here. I would do that more if I was planning on leg mobilizations versus just a plain old relaxation massage. There are definitely those massage therapists that do that full tuck or half diaper drape every time. There's nothing wrong with that. I just find that for a basic relaxation massage, it's not necessary. And you can see I'm using a variety of techniques, but I'm only doing a couple of reps. Those reps aren't rushed, so it still feels nice and satisfying and yummy to the client, but it's respectful of my time. It's actually more important to be respectful of the time than it is to get in there and get one more release and get that ooey gooey session, and if it winds up making you 5-10 minutes late, that is not only potentially making you late for your next client and disrespectful towards their time, it's also disrespectful to your current client's time because you don't know if they've got to go get their kid or whatever, so we don't extend the session without permission. Also because we bill by time. You know, some places, I've even worked places where massages were billed in increments of 15 minutes. So if you go over by 10 minutes, you're closer to the next price point than you are the original one they agreed upon. And then it's a whole question, so. I'm not putting pressure through my thumb here, it just happens to be hanging out. It could just as easily be tucked in. And again, as I redrape the leg, I keep my hands close to the body so we don't get that floof and there's no risk of exposure to the client. Goodbye leg number 1. Hello leg number 2. Leg is already kind of out to the side, but again, I would lift the weight of the whole leg and bring it out to the side so that there's room for me to do the tuck at the inner thigh without it feeling like I'm wedging my hand between their legs, which can be invasive even if you're low enough down. So with just a couple of minutes left of this session, I'm gonna start with my transition to closing again. Re-draping the client. And I'm gonna end with a hot towel on the feet. I do this for a couple reasons. It's yummy, and also it gets the oil off the bottom of the client's foot so they don't slide on the floor, leave oil, like slowly build up oil stains on the floor. And they don't go like sliding around inside their sandals if they happen to be wearing sandals or socks. If I had to, I would wrap each foot in its own towel, and then I like to do this little hot towel massage, which is kind of a nice, good little customer service thing, and is my stealthy getting the oil off their feet move. I will not leave the feet wrapped personally when I re-drape the feet here, because then they've got wet feet with wet towels that are quickly getting cold. All right. It's now 12:48, so I'm going to do my closing comfort goodbye stroke. Client has the arms up on the chest, so I'm just going to jump up to them. And it's now 12:49. So I take my moment of stillness, and then I verbally let the client know, because they might be asleep, that our session is over. I'm gonna get this wet towel out of your way, because it's probably getting cold by now. If I were in the opposite boat, where I was like, I still had like 5 minutes and I didn't know what to do, that towel foot massage would take longer, and I might do a little baby extra neck pillow to the neck as the focus area on my way up by, and just like hold and wait a bit. All right, that is our session. Thank you so much. Okay.